So good afternoon, everybody. Margaret Buckley is my name, and I was working on this project along with Dr. Siobhan O'Sullivan, who was the principal investigator. So just to quickly run through the running order of today. First, we will have welcome remarks from Celine Clarke, who is the Head of Advocacy and Communications with Age Action, who are Ireland's leading advocacy organisation for older people. Second, we'll have our PI, Dr. Siobhan O'Sullivan, who will go through the presentation of Ageing in Place in Rural Ireland, along with Annie Corbello-Lang, who is a member of the Participatory Research Group, and she also sat on the advisory committee for the project. After that, we will have remarks by Gabriel O'Keefe, who is the Head of Service and Wellbeing at the HSE, and then hopefully we'll have remarks from Inspector Miriam Maguire of the Garda Community Engagement Bureau. Lastly, we're hoping to have a hopefully spirited Q&A at the end. If I could just ask everybody to make sure that their microphones are muted so that we don't get any feedback on the recording. And of course, please hold all your questions until the end. Thank you very much. And now, Celine Clarke.
So welcome to everybody, those of you in the room here with us and those of you who are joining us virtually. So we're really pleased to be here to launch the research project called Agency and Ageing in Place in Rural Ireland. I want to firstly acknowledge the report's authors, Dr. Siobhan O'Sullivan, Dr. Margaret Buckley, Dr. Elaine Desmond, Dr. Eleanor Bantry-White, and Marika Casarino, and the members of the Participatory Research Group, some of whom are here today, and most, I think, are online, hopefully. So that's Therese Burke, Michael Cooney, Goretti Considine, Michael Cunningham, Annie Corbello-Lang, Joan Doherty, Ray McGrath, Linda Morgan, Margaret Mulligan, Josie Murphy, and Peggy Ryan. This research is contributing to Age Action's policy and advocacy work and programme delivery in our strategy towards equality for all as we age, which has a key objective at Ageing in Place. We also hope that it informs other policymakers and advocacy organisations as well to support people to age in place. Age Action has already cited the research in two recent fora, a submission to the Joint Committee on Housing, Local Government and Heritage, and a call for contributions on the right to adequate housing for older persons by the UN independent expert on the enjoyment of all human rights by older persons. So this is not a report that's going to sit on a shelf gathering dust. The research is providing stronger evidence of the preference for older people to age in their homes and in their communities through their choice of dwelling and location. As with other academic publications and policy research and conversations that we have around our own tables in our own homes, we know what we need and what we want to age in place. For example, a statutory home care scheme is key. We know that there's a pilot programme underway. We know that it's in the programme for government, and we also know that we've been waiting for it. We also know that the scheme needs to reimagine the provision of care, both for those who need it and those who provide it. Planning, housing standards and housing supports all play a huge role in determining people's quality of life as we age. The Housing for All strategy reiterates the goal of increasing the housing options available to older people and to facilitate quality ageing in space with dignity and independence. Not least, this is to be delivered through the local authority housing delivery action plans, delivering housing in line with age-friendly and universal design principles, and reviewing the grant programmes that assist older people to live independently. Age Action welcomes many of the provisions in the national policy documents, but there are some areas of concerns and more detail needed to ensure policy objectives can be achieved. The recommendations of Agency and Ageing in Place in Rural Ireland identifies much of the detail that is required, including the application and enforcement of universal design principles, access to adequate and affordable housing, access to financial products to enable people to modify or to move homes if they so choose, and security of tenure for the increasing number of older people who find themselves renting in later life, as well as age-friendly built environments. In working for equality and rights for all of us as we age, Age Action recognises that equality is underpinned by people having a choice and a say in the decisions that impact on them, their independence, their level of influence that they have in shaping our society through wider policy making. Therefore, facilitating the meaningful participation of older people in public policy development to drive social change is a core way of working of Age Action and in how we select which partners to work with, which is why we were honoured to be asked to participate in this piece of research by UCC that was funded by the Irish Research Council. The participatory nature of this project reflects the lived experience of older people, which further strengthens our advocacy capacity. And we are committed to the continued advocacy to support people to age in place. Thank you.
Thank you very much, Celine, for those wonderful remarks. And welcome everybody who's joining us here in person and remotely today. I'm Siobhan O'Sullivan, and I was leading the project along with several colleagues here in UCC, our fantastic participatory research group, and wonderful contributions as well from our research advisory group. So it was very much a collaborative, partnership-based project. And I'm going to talk through now some of the project background, the methodology, the research approach that we employed, and the key findings that are emerging. Partway through this talk, I'm going to invite Annie Corbello-Lang to give some comments and reflections on her experience of the research, before concluding then with our findings. So Celine has offered a very warm and detailed introduction there to our project, and its aims were to explore the views of older people on ageing in place, but where they choose to live and the enablers or barriers that people face to remain in their homes and local areas as they age. And we know from other research that the vast majority of older people wish to remain in their home and their communities as they age with a level of independence. But we need to understand how best to respond to the housing needs of rural residents who might be living in more dispersed areas or in areas with fewer services. And this is especially required now because across Europe, the population is aging faster in rural than in urban areas. And a similar trend is also evident in other places around the world, including in North America, Japan and other countries, and it's becoming more pronounced over time. And in Ireland, aging individuals are disproportionately concentrated in rural counties, and they do face particular challenges. Overall, according to Census 2016, and obviously we're all been recently engaged in the latest census, so it'll be interesting to see the population changes to 2022. But in 2016, 37% of Ireland's population were living in rural areas. And 44% of households that were comprised of people aged 65 and over were living in rural settlements. And these rural settlements, they're defined actually as quite small areas by the census. So the census defines rural areas as 1,500 people or less. So, you know, in these rural areas, these would be comprised of one-off housing, small clusters of homes, villages and small towns located outside urban centres. And I mentioned that rural residents aging in rural areas face particular challenges. And that's not just the case in Ireland, it's all around the world. But our findings highlight issues around care in the home, around home maintenance, around the absence of facilities and services like transport, healthcare and technology in the context of rural transformation and decline, as well as other issues like social isolation and loneliness, and the availability, as Celine mentioned, of other housing options. Now, the benefits of aging in place, they do depend on how attached an individual is to their home and their area, how well it suits their changing needs, their abilities, their preferences, which leads me to a very important concept in our research, the concept of agency. And that relates to the actions that people take to exercise control over their life circumstances and have the opportunity to be able to make meaningful choices to actually fulfill their preferences. Our project was also very much informed by the 8 interconnected domains identified by the WHO as important to making cities and communities age-friendly, and you can see them listed in the PowerPoint there. They've both informed, I suppose, the themes around our research, but also our methodological approach of partnership and inclusion of older people. And in relation specifically to housing and agency, the WHO emphasises having affordable essential services, appropriate design, the universal design that Celine mentioned, maintenance and modification of housing to enable people to remain at home, but as well as the provision of affordable housing options in the local area to accommodate people's changing needs and changing preferences possibly. It's fantastic to see the work of Age Friendly Ireland over time, who coordinate the Age Friendly programme in Ireland's 31 local authority areas to support the inclusion of older people, and to see the recent establishment of Age Friendly technical advisors working with each of the local authorities on age friendly housing, as well as all the other aspects of that programme. But it is important with ageing in place that we consider the variety of interpersonal and personal factors, not just provision of adaptation within the home, but the features and characteristics of the local environment that can make it, more challenging for some people to age in place. So we do need to consider the variety of subjective experiences and understand the differentiation between the housing and other needs of older people who live in rural areas as compared to those in urban areas. So hence the approach of our project. And we were very appreciative of all the work of Age Action and all its members in progressing this project. It really wouldn't have happened without that wonderful partnership and collaboration. And that brings me to our research approach, which is a type of community-based participatory research where we sought to involve older people in the research process. So it is a collaborative approach I mentioned that recognises the unique strengths that our partners bring, their distinctive voice, their experiences, their knowledge and ability. Celine has already mentioned the names of the 11 people who got involved in our participatory research group. I should say the research all happened throughout COVID, so it was all done remotely, which I'll mention some of the challenges of that. But it was also a fantastic experience for us to have that connection through a very isolating and challenging time in our country's history. Our approach also aligns with Age Action's mission of promoting the autonomy and empowerment of older people and the WHO age-friendly themes of civic participation, of respect and social inclusion. So we had several steps in the process of the research. The 11 members of Age Action who took part in the research. There were 8 women and 3 men, ranging in age from 67 to 82. And they were recruited through Age Action's Glór advocacy group and University of the Third Age membership. And they were from all across the country. And they worked with myself and Dr. Margaret Buckley to develop and formulate questions relevant to their lives for a nationwide online survey and postal survey. So when we collaborated with that group, we then piloted the survey and we extended it through Age Action's membership, when 218 people living in rural areas across Ireland subsequently took part in that survey last summer. And then 19 people after the survey was completed took part in online focus groups run by my colleague, Dr. Elaine Desmond. And the steps in the participatory process of working with the participatory research group, there were several aspects to that. We started off with one-to-one meetings. Then we had 4 online workshops. Sometimes they ran on for hours, and you might recall our tea breaks and our much collaboration and work, but we stayed in touch as well across those meetings by email, by phone, by post, with a special, I suppose, focus on including those who didn't have good broadband. And one member actually solely got involved through phone and by post because broadband in his local area wasn't sufficient to take part. We also incorporated training on research methods for better involvement of people in the project, and did our best to create a good environment for involvement, sharing an open agenda a few days in advance, the training videos, questions for discussion. And as I mentioned, it was just, for me personally, a very meaningful experience at such a challenging time. And I felt that we built really a bit of an online community. So the challenges, of moving research online during COVID, we were all confronted with this very, very quickly. The research funding was awarded in March 2020. So we had to immediately figure out how to run our project. But I think through the steps that we undertook, through the patience and collaboration of the participatory research group and Age Action, we found the process to be really very good. And also working online with our research advisory group that Celine also mentioned, Age Action members, UCC academics, representatives of the Health Service Executive, and Annie as well. Their contributions to the research, steering the research, advising us on the progress of it has been really invaluable. I think Age Action also providing the Getting Started kits really helped us. But as I said, those issues with rural broadband, they did hinder participation for some. And it is, it's part of the ongoing inequity really in rural broadband in Ireland, where a greater proportion of rural households have no internet connection when compared with urban households. So being mindful of that, I suppose we had to incorporate all of those different steps. I think they added to the richness of the project as well. So I'd like to invite Annie Curbello-Lang to say a few words on that process before I then turn to the findings. Thank you, Annie.
Hello and welcome to everybody. It's wonderful to be here and have the opportunity to actually meet these wonderful women. In this particular case, we're all women here, but that doesn't exclude the male parts. I'm really delighted to be here. I was first approached by Siobhan O'Sullivan and Margaret Buckley to take part in this project, and I was immediately interested because I live in a rural area in Roscommon, and I had been staying with a friend for over the COVID period, and I was looking for my own accommodation. So I went through all of the processes, and myself and my fellow young pensioners, as I like to think of them, often talked about the idea of where we would see ourselves as we get older, okay? Most of us said, no, we didn't want a retirement home. And I do apologize to all the retirement homes that are in the world that have done an amazing job up till now, but we would like a change. So none of us wanted the typical, as I said, nursing home situation. And we had seen other options abroad where people lived in kind of community areas where you could, what was that phrase that we had that was brilliant? Go-go, no-go. No-go was the end. It was go-go and slow-go. That was it. Whereby that meant that if you were totally independent, you could live in an area where you had services and assistance, etc. And then as you got older and maybe needed a bit more assistance, that was supplied. And then when you got to the stage where no go, you needed complete assistance. And we all agreed that we never wanted to get to that stage, but it can happen. But anyway, the idea of presenting a well-researched document to the government, as we, the older citizen, would like to see available for us so we could look forward to enjoying our golden years, seemed a great opportunity. And I thoroughly enjoyed the interaction on Zoom with everybody, with all the 11 participants, including myself. We became kind of Zoom friendly, you can call it that. And we talked to each other and realized that we all lived in different parts, but a lot of us, all of us basically, had the same needs and the same desires. We need better service in our community, which allows us to continue giving to society in a positive way. I had the pleasure of meeting some very capable people who were helping with the project during all this time. And I just like to say that life is from birth to death. There is many different sections, and all those sections are important to all of us. And we all give something to the society, no matter what age we are. I commented on how we look forward to our meetings, and it gave us an interest during the COVID, especially at the very beginning, when we're all kind of unsure what was happening. So it was great to actually talk to people, even though it wasn't three-dimensional, but it was brilliant. We all must realize that no matter what our age now, we will all eventually end up with particular needs as we get older. The more research we do now, the more we can help make sure that as young people come forward and get older, they too will have good options for their future. So we're laying the foundations for this, not just for us, but for future generations. All ages provide a variety and necessary daily and future life for all of humanity. Given the right opportunities that society can give, we can all live happier lives. I believe the cost of providing care for the older generation can be spent so much better and more wisely by giving better facilities so that each person can live their lives more independently and add to the colour that is our world around us. So thank you very much for giving me the opportunity to come today to talk to you all, and hi to all my fellow participatory group who unfortunately aren't here, but hopefully one day we will all get to meet again. And thank you again.
Thank you so much, Annie, and well done on those wonderful words and on all of your amazing contributions throughout this project. I'll turn now to some of our findings, but before that, just to give you some of the kind of key headings around what this survey asked. So we started by looking at people's demographics and then asked questions about your home, whether you might need housing modifications, housing options that you would consider, what would help support you to age at home and to age in your community. So in terms then of the findings, as I mentioned earlier, the participants were from all across the country, and Margaret has produced this wonderful map to show the spread of engagement with the survey. So every county was represented in the survey, with the highest proportion of respondents from Munster. Most of our participants owned their own home, 94%. Smaller proportions were renting or living with relatives, and that maps onto the current census research. Most of the participants in our survey live in open countryside or one-off housing. You can see that there, 48%, with 22% living in small towns, 19% in villages, and 11% in other situations. We had a good spread of age as well, although there was a greater representation of respondents under the age of 75 in the survey. 70% of the respondents are female and 30% male, and most people consider their health to be good, 72% of people who participate in the survey, but a lower proportion considered their mobility to be good, so 57%. And you can see there that we had participation right up to people aged 91 years and over, and all the way from 55 years. So it was a fantastic representation. There's three themes then that I want to go through in terms of the key findings. The first is around that key message that participants want to remain in their homes and their communities as they age. The second is that they identify supports, but also challenges for aging in place in rural areas. And these are both in the home and in the community. So I'll talk through some of those. And the third is the housing options that people identify for outside the home, but bearing in mind that most would prefer care in the home. So here is a chart to show you the proportion of people who said that it is very important to them to remain at home as they grow older. So that's 78%. And this is very similar to previous research and supports really, I suppose, the existing field of research in this area. In 2015, Age Friendly Ireland did a survey that found that the first preference for most older people in Ireland, 78% also, is to adopt their own home. And participants, as I said, express that strong desire to remain in their homes and their communities. So you can see here the figure on people remaining in their community is 63%. So it's a bit smaller than people remaining in their home, but 30% said that remaining in the community is somewhat important to them as well. And people are very attached to their home. They're attached to the home itself, the home environment, but also the landscape, the neighbours and the community. And I just want to play you a short snippet from one of our focus groups from Sean in Roscommon, describing his connection to his home. Let me play it.
I can walk around my house at night time with no lights on, and that's an absolute pitch black dark, and I know exactly every corner of it and every door of it and everything. So if I was blind, I would be able to manage to get around my house. You know, that's the kind of feeling that I have attached to it, you know.
And thank you to Sean for his contributions to the research as well. So many people expressed being part of an active community life in our project. So people would say, you know, that they're happy living among people that they know. I've known nothing else. I'm valued by the community. We've such good neighbours. And most of the participants in our research interact with their friends, their family, their neighbours daily or several times a week. And they love the beauty of the area, the scenery of nature, and other research that we touch on in our report highlights the importance of rural environments to health and well-being. So the restorative properties of nature, the important active lifestyle elements, the less stressful environment than cities. And we also found in our research that that sense of attachment had grown since the pandemic and been strengthened because of the pandemic. So a sizable number, 43%, said they're more likely to want to remain in their own home since COVID-19, while just over half, 52%, said their views hadn't changed since COVID-19, indicating, you know, how significant it already was for people to want to age in place. When people talked about the reasons that they wouldn't like to move, you know, the key things there really were the lack of proximity to family and friends, missing your home, missing your community, but also aspects around the lack of suitable housing in their locality, the issues around financial affordability, and for a certain proportion of people as well, having family care commitments. One survey participant noted the challenge of moving for older people and said, you know, moving is difficult at any time in life, but in older age, it's traumatic. But we should also highlight in the course of this research, we did find, you know, diversity among older people. So some of our participants did have more tenuous living arrangements, and especially for those who are renting, as Annie mentioned as well, which is very precarious in Ireland, no matter what age you are, but we would have particular concerns for older renters. But also those people who might have recently moved, maybe to be closer to children and didn't yet feel embedded in their community. So I'm just going to play you another short excerpt from Hannah on the precarity of renting.
I suppose after 46 years of owning my own house, I am having trouble getting into this mindset of being a tenant. And I do appreciate that there are tens of thousands of older people who are tenants. And I suppose the worst aspect of it, of not being able to do anything to, you know, to your property, I have no pictures on the wall, I have them standing on the floor, for example, is that the uncertainty of your tenancy. I don't know when I go to get a letter in the post any day to say, you know, sorry, you know, you've got to go.
And thank you too to Hannah for all her contributions. I should have mentioned when I mentioned Sean that these are pseudonyms, so we're not using the names as people aren't identifiable. But from our research, you know, it's very evident that we can't assume that all older adults share a homogenous set of living circumstances that can be addressed with one-size-fits-all solutions. So it's essential that we pay attention to the diversity of the aging experience and the variety of needs of older adults. Turning then to the supports that would enable people to remain in their home. And people identified many different types of supports, but one of the primary ones that people spoke about was a home repair or maintenance service for older adults. One participant was talking about how, you know, I'm not going to be able to do this much longer regarding, you know, some of the housework around drains in their house. People expressed concerns about managing their gardens. People expressed concerns about the cost of getting work done. The need for a properly paid and resourced home care scheme, which would support older adults to remain in their homes as they age, was particularly emphasised. And it highlights the importance of the statutory entitlement to home care. And participants were also concerned about the shortage of home carers in Ireland to assist older people to live independently and the over-reliance on nursing home care. And for those, especially those with health and mobility problems, they worry, like one of our participants said, there's that fear, what is going to become of me? And this is described by Lucy in Kildare, who we'll now listen to about her concerns about ageing at home.
And those of us who are older, and especially those of us who've compromised health and mobility, there is that fear, what is going to become of me? Now, obviously, the difference is if you have a good pension or you're financially, shall we say, comfortable, you're going to be less worried. But if you're not, I would like the government to take on board, instead of putting us into nursing homes, they're going to look at helping us to remain and live independently at home with supports. And that would be my chief concern.
And thank you to Lucy as well for all her contributions. And finally, then, in terms of the supports here, I'd also like to emphasize the participants talking about a more accessible grant system to fund modifications to the home. So people found the current system quite cumbersome and difficult to manage. And we asked people as well, what kind of home modifications would they like to make? And chief among those was a monitored personal alarm, an emergency response system, bathroom modifications, and improved heating and insulation. Obviously very important now in the light of climate change and all the energy issues that we're facing at the moment and energy transitions. And lower proportions also talked about modifications for easier access, ground floor bedrooms and bathrooms, and improving lighting. And you can see here some of the quotations from the survey and the focus groups around those issues around home maintenance, for example, around cutting the grass, around heating the home and having access to it in terms of stairs, and around the importance again of insulated housing to reduce heating costs. So I suppose you could say the qualitative viewpoints are also very important to us in the course of this research. So I feel that we have both the numerical side, the numbers, but we also have the in-depth views and perspectives of people that really provide us with that rich and important picture of people's experiences. And turning then to the challenges of living in rural areas. So whether people were settled in their homes and communities or not, all participants highlighted the uncertainty of their positions and for many their fears as well about being able to have their preference for remaining in place realised as they aged. So 2/3 of participants, you can see it there, 66%, said if they were to consider moving, a key factor would be needing access to public transport. And one participant said lack of public transport is likely to be an issue when I'm no longer able to drive. And at that point, a decision about leaving our house will have to be made. And people would also consider moving to be closer to amenities and to healthcare facilities, to family, if they needed a smaller sized home, as well as fears for their personal safety. And so we asked people, how safe do you feel in your home in terms of crime and security? And 44% of people said they felt very safe, 50% somewhat safe, and 6% not at all safe. And people do feel safer in terms of physical hazards in their home, but in terms of crime and security, that's where we could really see the issues arising in our study. And an additional factor that over 1/3 of participants spoke about was needing to move for feeling lonely or isolated, and issues around the cost of maintaining your home, and other factors that you can see there were also mentioned by our participants. And the general decline of towns and villages was highlighted by participants. So you can see in these quotes here, the emphasis around the loss of services. And the Great Recession from 2008 to 2013 really intensified economic decline in Ireland, and especially in rural areas through austerity. And this contributes then to the marginalisation that older people in rural areas experience. So you can see here the lack of public transport that we've mentioned, the loss of banks, post offices, churches, shops, and the local police presence as well were some of the key concerns. And that lack of access to public transport can mean the difference between receiving and not receiving services or having opportunities for socialising. So it is such a crucial factor there. And also the lack of healthcare services. People spoke about not having local healthcare services or local hospitals that they could easily access, and the difficulties that they face then in having to travel to more urban areas to access city hospitals. And finally, participants in our research also highlighted their experiences of marginalisation and ageism. Being seen as invisible, as this survey respondent says here, and being subject to ageist stereotypes. And I think Annie reflected on that really well as well. And they argue there's a need to tackle this ageism that they experience in their everyday interactions. So to wrap up then on the findings, I'll end this by talking about the enablers for aging in place. What are the factors that would support people to remain in their community? And you can see there's a whole host of different factors that people identified, but chief among them, the first factor there was having someone to rely on living close by. So the supports required for aging in place, they're not just physical infrastructure, like healthcare services, but they're human infrastructure too, people to come in and to check in on you. And other key aspects highlighted: access to broadband, conveniently located shopping and postal facilities, health facilities, greater Garda presence, text alert services, all of those, and the public transport, all of those aspects that I've mentioned. But some additional aspects came out here that are also key to focus on, like activities for older adults, wellness and fitness, volunteering and education. They all garnered high levels of support. And so older people want to be part of the community, want to be involved and socially participate. And other research shows the benefits of that, enhancing well-being, tackling loneliness and social isolation. Obviously, these are distinct concepts, but they are, having impacts on the aging process and on people's quality of life and health outcomes. And I think the final point I'd make on these findings, it's very interesting to us to see the emphasis as well on the access to broadband and digital technologies. This was really emphasized by many of the participants too. And it's an important factor considering older people's participation in community, but it was particularly important during the pandemic. And our participants argued not only for greater access to broadband, so one person said, if I had proper broadband, I could be on doing a lot of things, but also the need for training in technology, so it becomes an enabler rather than a barrier to remaining in place. And finally, then, the housing options outside the home that people identified. And people would prefer to live independently in their own communities. It's a key message from our research. And the top choices there are retirement villages, cooperative housing, and supportive and sheltered housing, as well as intergenerational housing. But these options are very limited locally, if they're present at all, meaning that people would be required to move from their communities as well as their homes if they wanted to pursue something like this. So in some of the survey respondents, when they added comments to the survey, they were looking for, building close to their existing villages, living in their local community. And along with this lack of suitable housing, financial affordability of these housing options was also emphasised by our participants. So they proposed state subsidised rather than private provision of these different options. And he has already articulated very well the lack of interest of older people in our research of moving to nursing homes. And most participants were, quite opposed to nursing homes, except in cases of critical care. So, there was a nuanced debate around it as well. And it was a view, though, that the experience of the pandemic had reinforced. So they argued that instead of focusing resources on a nursing home option, government should develop a statutory home care scheme. And that leads me then to conclude with our recommendations. And Celine has mentioned those as well. We created 16 recommendations to government and civic organisations to support people stay in their homes and their communities. And there's 4, I suppose, thematic areas around that, to explore ways to support people to stay in their homes and their communities. Covers the need for the statutory home care scheme, greater funding to extend the existing home support services, developing home maintenance surveys and supports in rural areas, making the grant process for home modifications less cumbersome, recognising the vulnerability of older renters through targeted subsidies and supports, and conducting a review of pensions and financial supports for older people, given the rising costs with ageing and specific expenses with living in rural areas. The second one looks at developing the range of housing options in local rural communities for older people that are affordable and state subsidised. The third is to implement a whole government approach to the supports required to ensure the agency of older adults can be realised, and connecting that to rural revitalisation. So including all those aspects that I've mentioned: transport, healthcare services, the rollout of rural broadband, nationwide technology training scheme for older rural dwellers, and nationwide programmes around rural isolation and loneliness. And finally, we recommend hearing the voices of older people and challenging ages, and by involving older people living in rural areas in policy making and decision making in all matters concerning them. So these are our very detailed recommendations. Then they'll be available in the report for people to look through. And the report will be available on the Age Action website and on the UCC website. And I'll conclude by, I suppose, just reflecting that need for comprehensive holistic approach to supports and rural revitalisation to ensure the agency of older rural residents can be realised. So there's a multiplicity of factors that were detailed by older people in our research that, along with housing, would help support older people to remain in place in their homes and communities in rural areas. So for the participants in this study, aging in place is not simply about asserting their preferences as to where they would like to age, but it includes implementing these supports across home care, across housing, across maintenance, across healthcare, transport, technology, and revitalising rural areas to reimagine rural Ireland and enable older people to exercise their agency. And this requires coordination and integration across several different policymakers and involving older people in the research and policymaking process. So I conclude by saying that I hope that through this research, we have shown through our focus on our process that how to best respond to the housing needs and preferences of older people must be identified through their direct experiences, their wishes and their decisions. Thank you very much. The links to the report are here, and I'll invite Margaret up for the Zoom. Is that correct, Margaret? I'm going to see, or I can see if Gabriel is available. If I stop sharing, thank you. So Gabriel O'Keefe, Head of Service, Health and Wellbeing Strategy in Cork Kerry Community Healthcare with the HSE, is going to say a few words on Zoom for us.
Thank you very much, Siobhan, and good afternoon, everybody. Can you hear me?
I can hear you great.
Yeah,
thank you.
It's working, so which is good. You can't always rely that it will. Thank you very much for the invitation to participate in the launch today, and just to say a few words on behalf of the HSE. Firstly, I'd like to congratulate the researchers and all of the participants and the research advisory group members, and we were very happy to support the process through Dr. Sheila Broderick in our Health and Wellbeing Department. So I'd like to congratulate you really on a very, I think this is a very powerful piece of research. It articulates very clearly and I suppose reinforces or confirms people's preferences, and I suppose what all of our preferences are in terms of our choices, our opportunities as we get older in terms of where we live and how we live, which is extremely important. From the HSE perspective, I'm a head of health and wellbeing now, but I was head of older person services for a number of years prior and leading into the pandemic up to last year. Undoubtedly, the pandemic had a very negative effect on all aspects of the population, and most particularly for older people. And I think it did remove elements of choice that were there previously from people, you know, which is extremely regrettable. And I suppose it's incumbent on all of us, and as the report clearly outlines, in a whole government approach to try and address that going forward. In terms of the HSE policies and around older people, we have adopted the policy of home first for some time now, and considerable investment has been put by the Department of Health into the home support service, which is the key service that we provide to enable people to continue to live independently and productively in their own homes. The funding was a barrier, but once we got the funding, as usual, we encountered other barriers in terms of trying to source appropriate staff. So that is actually a big challenge for us, particularly in rural areas. And I suppose it reflects some of the issues around the communities and, you know, the loss of people of all age groups in those communities in the country. So that is something that we are working on to try and address to maximise the use of that funding to support as many people as we can at home. We also work through day centres. We have 41 day centres in Cork and Kerry, and there are many more around the country that also provide a vital link, I suppose, with the local health service for older people who are living at home. And it just gives them access to a local link into various services of nursing, podiatry, physiotherapy, etc., where it exists, and we are also working to improve and increase those services as well. without going into great detail, which I'm sure you're not too interested in, our overall community policy is to provide health services in an accessible manner locally in community healthcare networks to populations of around 50,000. And that is our focus going forward, to try and bring the services to the areas so that people can access them from home where possible. Again, I welcome the recognition that a multi-government and agency approach is needed here, and we are happy to continue working in partnership with Age Action on the age-friendly committees, which I think have also been a powerful informant to the HSE and to local authorities in terms of the development of services and supports for older people to support ageing at home. The area of social connectedness and isolation, I think, is one that's extremely important as well. We try to work through our community departments to support groups. And I suppose personally, I have a strong belief that really it doesn't matter what age you are, if you want to engage in an activity, there should be opportunities and supports there to enable you to do that. You know, there is an image possibly of kind of, you can almost have an institution at home if you don't allow for that choice and that inclusion in community. So again, I'd like to thank you very much for the invitation to be here today and to congratulate you on this piece of work. I think it's a very clear articulation of people's wishes and desires, and I hope that it will be used to inform policy across the board and within the HSE. I will certainly be sharing it widely with my colleagues, both in health and wellbeing and in older person services, to inform our practice going forward. So thank you very much again.
Sorry, I was muted. Oh, the joys of technology. Thank you very much, Gabriel, for that. That was really wonderful, and it's so fascinating to hear about all of the work that you're doing. And I do hope that we'll be able to work together again in the future at some point. And now we actually are delighted to welcome Inspector Miriam Maguire from the Garda Community Engagement Bureau.
Good afternoon, everyone. I'm deputising today for Superintendent Michael Corbett of the Garda National Community Engagement Bureau, and he sends his sincerest apologies. He's really disappointed that he couldn't make it here today. I'm delighted to represent An Garda Síochána at the launch of the research report, Agency and Ageing in Place in Northern Ireland, funded by the Irish Research Council. I'd like to thank Age Action and School of Applied Social Studies, UCC, for the invite and the opportunity to talk here today. I wish to acknowledge the work done by Age Action and all the other organisations in Ireland who support older people. An Garda Síochána have worked with representatives from the sector, particularly through the COVID-19 pandemic, and I'd like to compliment all of those for advocating for this sector. We in An Garda Síochána recognise that working with older people and older persons organisations is a key factor in establishing and developing relationships and enabling people of all ages to work together for a positive future. As an organisation, we recognise that a proactive approach to working with older persons gives us a clear expression of our core values in An Garda Síochána and our commitment to keeping people safe. It's important to ensure that all groups in society are represented, and An Garda Síochána is developing in this area. We are continuing to work and engage with diverse groups of people, and we look forward to working together in the future. There are a number of important areas of work where we do interact with older persons, and we are currently updating An Garda Síochána's older person strategy. This work is ongoing. While face-to-face meetings were impacted by COVID, we're hoping that the engagement piece for this strategy will now advance, and we'll take it from the consultation phase, the views of the rural communities, and take into account the views of the external stakeholders, community groups, advocacy groups, and examine local strategies. From An Garda Síochána's participation with the National Age-Friendly Advisory Group and the National Rural Safety Forum, we have seen and heard firsthand the positive results of the collaboration between An Garda Síochána agencies and organisations such as Age Action, who work together to support older people. Some of the challenges faced for older people in rural communities include, and as research has shown, fear of crime, isolation, poverty and social exclusion, access to services, and very much communication. As an organisation, we want to ensure that the policing needs are met, and I want to provide assurance that the Garda response to older persons' needs will be consistent nationally, and that we will provide a service to older people that meets the requirements of this group. In addressing the issues on Garda Síochána, we'll build on the support we have with our community partners in maintaining community safety forums and reassurance and support social inclusion for older people in rural communities. I think definitely the COVID-19 pandemic impacted on everybody, and from Garda Síochána, the existing community policing units were in a good position to quickly identify the vulnerable elderly in our community. Their knowledge was important in ensuring that programs such as Community Alert and Text Alert were used effectively to support in the response to the pandemic. In maintaining this community policing service, An Garda Síochána will support the implementation of the new framework for community policing in Ireland, which is currently being rolled out. This will support many of our other community policing initiatives with our community partners to support older people, and includes welfare checks and home visits, providing crime prevention advice to older persons through community safety days, use of Garda clinics in rural community centres to give easier access to the population to the services of the Garda station, particularly in areas which may have lost their Garda stations, provide support to older persons' organisations. And I suppose a recent example of that was this year, where the Garda National Economic Crime Bureau and the Cybercrime Bureau provided online training sessions to Age Action volunteers in the areas of financial scams and cybercrimes. And this is an area where we're seeing a big increase at the moment, particularly targeting the vulnerable in our society. The publishing of crime prevention and information leaflets and graphics on a variety of topics such as home security, and I suppose very importantly, utilising crime prevention through environmental design and working with planners and local authorities to ensure the physical design of areas supports a reduction in antisocial behaviour and crime. I'd like to congratulate you on the research. It's an absolutely fantastic piece of research. The findings, I'm sure, will help all stakeholders in planning going forward. And I'd like to thank you as well for giving me the opportunity to speak with you here today. And just to reassure you that everybody in An Garda Síochána are committed to working in partnership to provide the best policing service possibly we can to keep our elderly safe and to support you in this initiative. Thank you very much.
Thank you very much, Miriam. That was absolutely wonderful. And it's fantastic to hear about all of the different initiatives that the Guards have taken on, especially over COVID. And of course, as we know, lots of different things overlap. So between the big HSE hack and then the scam phone calls and everything else throughout. So really wonderful. So now we have come to the end of our presentations, and we're now going to open the floor to our audience. If anyone would like to ask a question, you can either use the chat function, or indeed you can raise your hand, and anybody has a question. If not, I'll start it off. Yes, Therese.
Margaret, you'll forgive me, it's not a question, just a comment. I can't not comment, and I'm so sorry not to be there. I really would love to have been there today and meet you all in person, but I think it's kind of apt that we did it all on Zoom, and here I am again, Zooming. So I just wanted to say huge congratulations to yourself and Siobhan and everyone else on the team. I want to salute you. And it's a super piece of work and research. And it's fascinating just seeing it all put together there. But as a participant, I wanted to salute you on the professionalism of the team, the quality of your guidance for us. You know, it could have been a talk, you know, people talking at us, patronizing us, but you didn't. And that was a good thing. And I also want to say how impressed I was with the rigor of the work, because, you know, you didn't just kind of get us together to talk and ask questions. You kind of give us a little bit of training about research work. And that was a kind of a respectful thing to do for us. For me personally, anyway, I felt that you were taking us seriously. I want to say how much it was a pleasure to take part in the research. And it was so meaningful, especially in COVID, when we were all locked away, I suppose, and a lot of people my age and older weren't even allowed out the door. So it was so stimulating and provoking. It was kind of a chance too, I know we were probably all reflecting on our lives, but it was a chance to address kind of important questions, I certainly for me, on my own life. And, you know, I suppose I wasn't really thinking of the future, but it was good. It helped me kind of reflect on what I wanted myself personally in my own life, and then also on how other people were experiencing their lives. So for all that, I want to say a big thank you, a million thanks really, for it was a really brilliant experience and a great chance. And as you can see, I like to talk, so it was a great it was a great chance to talk and about things that maybe were a little bit more important than the ordinary old chat that we go on with. So thank you. I do hope there will be a chance in the future when we do meet face to face in the flesh around a cup of coffee or whatever, rather than turning off the screen and going off for the virtual coffee and coming back. So many thanks. And I'm really looking forward to reading the report. Thank you. Bye now.
Thank you so much, Therese. It's really wonderful to hear. And I'd just like to comment on the non-patronizing, respectful bit. With the group that we had, there was no other way to approach it. In fact, it would probably have been dangerous if we had. But it was, and I think I can speak for the entire research team when I say it was an absolute pleasure to work with you, to meet with you, and to get to know you all. It really was. It was actually less about work for us and more about enjoyment. So really, thank you very much. Right back at you. Ray McGrath, you have your hands up. Hi, Ray. How are you?
Hi, Siobhan. Great to see you again, hear you. And really, I want to echo everything that Therese has said. Congrats to you, to your team, to all the participants. And I just want to add, Therese, to what you so well said, that it was as a participant, it was a very affirming experience, Siobhan. And I hope the way you went about this research will become a template for the involvement of older people in much of the research that is done about older people, and that we, in a sense, are speaking for ourselves with our own voice, and that's echoed in the report. So I do hope that it becomes, I think it's it would be a very good thing if it were to become a template for further research. So thank you very much.
And thank you, Ray, as well. And again, really enjoyed working with you. And I think you're absolutely right. It would be wonderful if this were, I suppose, forming even a framework going forward in the future for future research. Dennis, leave your hand up.
Hello. Congratulations to everybody involved in the research, everybody who took part and those who organised it, and for the recommendations. Was there any suggestion as to, I know that in the implementation of things around, let's say, even the SEAI in connection with retrofitting housing, there's some one-stop shops. Is there any idea as to who would coordinate locally the different, I suppose, actions that people could access, locally? Who would they go to get these services?
That's a very, very apt question, Dennis, especially in the current climate. I might actually just turn to Dr. Siobhan O'Sullivan, if that's okay. So I'll just scoot off screen for a moment.
Sure, thanks, Margaret, and thanks everybody for your wonderful comments and questions. And Dennis, I think that's a great question, and I think that's something that we could put to Age Friendly Ireland and to looking maybe to the housing technical advisors. So if you're happy for us to note your comment, and we can stay in touch with you then afterwards. And we, I think we recognise that there's other things that could come out of this research too. As Celine said, it won't just sit on a shelf, but I think that's it's a great comment. So thank you.
There may be someone from the local authority.
Yes, good idea, Sheila. If there's anybody online from the local authority who might like to add a word on that, you'd be most welcome. No, there may not be. Okay, yeah. Great. So thank you, Dennis. I'll hand back over to Margaret.
Thank you. See, this is the joy of doing a hybrid version, that we have to swap and change. So I just see there's a couple of comments in the chat, so I'm just going to open that here. Remind everyone to, thank you, Peggy. Yes, remind everyone to engage in local authorities' public consultation on future plans to give voice to our older needs. We now have 16 recommendations to submit. Absolutely, Peggy, you're spot on, and that is an excellent piece of advice and a reminder to people. And Gertrude Cotter just says, just want to say that it's important that we are talking to people in the HSE and Gardaí. Yes, absolutely. This is our research finding should be presented for everything. Oh, well done to the research team and to the participants. Great piece of work. It is so important that we keep talking about older people's issues, rights and needs, and listen deeply to what is being said. I couldn't agree more, Gertrude. Absolutely. And thank you very much. That's really lovely about the research. And Marika, who was part of the research team, wonderful presentation. Well done to Siobhan and Margaret Elaine, everyone involved in this research, and delighted to be part of it. Thank you, Marika, as well. It was wonderful to work with you throughout. Citizens Advice Bureau are excellent for info. Yes, absolutely, Peggy, they are. The citizens information are brilliant. Absolutely. Huge congratulations to everybody involved. Congratulations to Siobhan and the team, an excellent piece of work. Older people of Ireland are fortunate to have you on site. Oh, thank you. We will do our very best to continue battling forward with, of course, all of your help. Because we really couldn't. I know it's been said a number of times. Siobhan said it multiple times, and she's absolutely right. And I don't think it can be said too many times. This research would not have been possible without input from yourselves. So please, in the future, if you see a call from one of us, please do respond to the research. So does anybody else have any questions, comments? Yes, Margaret Scanlon.
I was just wondering if you noticed any sort of regional variations in the research. I suppose I'm thinking that some places are obviously more rural than others. I don't know if there was a chance to look at that, or I know that in some areas there might be some kind of initiatives running already that are help people to remain at home. Like in some parts of Ireland, you might have a rural transport scheme, and then in other places there might be nothing.
Yes.
So I just wondered if any kind of variations like that might come up in the course of the research.
So just for people online, just in case the question here in the room didn't translate, we're just being asked if there were regional variations around the country. So we weren't looking for specific regional variations in terms of transport or access to services, but we did notice a variation in terms of, I suppose, isolation, where the house is, in terms of settlement size. So in the west, up Galway, Mayo, Sligo, Roscommon, there tended to be a greater number of open countryside one-off housing, whereas Munster, actually, Cork in particular, it tended to be larger settlements of between maybe 5,000, 10,000. Kerry, it was fairly even actually across the board. And then of course in Leinster, it was maybe 5,000 to 10,000 as well. So up the west was more smaller settlements. Yes. But that is actually the regional variations is a good idea to look at going forward, because there were, I think, sorry, there are no questions, so I'm just going to talk for a few minutes. If that's okay. There were a number of things that came out as part of the research that I suppose we weren't specifically looking for, but we are hoping to maybe examine going forward in the future, regional variations absolutely being one of them. But another was, again, we weren't specifically looking for crime and safety, but it came through very much so, particularly in the survey, that people actually, even without being prompted, wrote in that they didn't feel safe in their own homes, that they would like to see greater Garda presence, that they would like to see neighbourhood watch, that they would like to see the fitting of alarms or even emergency response buttons. So I think that is something that we will have to look into in the future, probably using the same data, because again, you're also wonderful at responding that we have quite a lot. So that's, yes. So there are no more questions, comments? No?
I should just clarify one thing, and again, to echo everything well done, and it's been a joy to engage with this sort of participatory approach. But just in terms of the demographics, which I know you captured, and I know this is a report, but just in terms of the representativeness of it, are there particular groups that, if the study was to be conducted again, that you might like to try and really kind of sample or target? Was this representative of the diversity of views across the Ireland, perhaps by income or by education level, or that sort of things?
We actually spoke about this at the very, very beginning, at the outset. Oh, sorry. Sorry, just to reiterate the question there for everybody online, just in case you didn't hear it. We're just being asked about the representativeness of the demographics in terms of the participatory research group, as well as the survey respondents. So we actually did speak about this at the very outset. No, you're fine. No, at the outset of the research. Yeah. Back in 2020, we actually did talk about this, and it's not actually, it wasn't feasible. It just simply wasn't feasible to capture absolutely every older person in Ireland. And working through Age Action, which is fantastic, because Age Action facilitated our connecting to people around the country. Yes, but we are only capturing the people who are members of Age Action or GLOR or U3A. We're not capturing people who, say, for example, are, don't have access to that kind of community. So yes, from that point of view, it is. But we did, I believe, Annie, at the very beginning, the first time we met for the participatory research group, we made it clear to our participants that we're asking you to be representatives of older people in the country. So we'd like you to think of your own situation, as well as people who are not in your situation, but that you know of. So that's what we asked our participatory research groups to do. And I do hope that we captured, even though we weren't able to maybe reach everybody, I do hope that through the participatory research group, we were able to capture a lot of the issues that are facing.
But this whole project as well, when it's
you know, publicised and out there,
Mm.
may also create a whole other response.
Hopefully,
You know? Yeah, I think
hopefully,
so.
absolutely.
Chat.
New chat. So very interesting report as librarian Cork County Council. Oh, lovely to meet you. I would also suggest your local library for information and classes. Mobile libraries also travel to more remote and rural areas, and we'd love to help in any way we can. That's wonderful, Stephanie. Thank you. 58% of participants noted daycare services as important. Is there a breakdown of the availability of daycare centres in the various regions?
Well, Gabriel might want to speak to that.
Oh yes, if Gabriel would like to.
Yeah, we would know the daycare centres. I suppose, yeah, we've been doing a piece of work which has been considerably delayed by the events of the last 2 years in terms of daycare centres, because I think the term daycare centre can mean different things to different people. In some cases, it's, you know, it's a social centre, and I suppose that's what a number of the voluntary daycare centres started out as. So there are a range of daycare centres that we fund. Some of them we provide directly, but they do have a specific health component. And usually at this stage, because of the, I suppose, the increased needs of people living at home and the capacity to assist people to remain at home for longer, they have a very specific remit in that way. So some of them are general, and they have general days at which people attend and they can see the nurse, you know, the various services, healthcare services, visit them. And there are also specific Alzheimer's daycare services, which actually are extremely beneficial, and there's not enough of those at all. So as I say, yeah, we can give a list certainly, but it's a referral process because it is really a health input and at quite a high level from our point of view at this stage. The more social side of it is more community based, and look, I can see, can I get a list of those from our community workers maybe as well, but just to say the list I have is specifically kind of healthcare provision related. Is that okay?
Absolutely, Gabriel. Thank you so much, and apologies for putting you on the spot.
No problem. I'm used to it. Thank you.
Thank you so much. Well, if there are no more questions, I think we may draw things to a close. Thank you very, very much to everybody who's here in person and who has taken the time to log in online. We really appreciate it. And once again, a huge, huge thank you to all of our participatory research group, our survey respondents, our focus group, our advisory group, and everybody who helped, because there have been so many people who did help so much with this research, and the research would not have been possible without you. So a huge thank you. And if I could just get a round of applause for everybody. Thank you so much again, and I'm now going to stop recording.